Hi, everyone. I'm Spencer. I'm host for this room. Just as we get started, a few Clubhouse pointers. You can use the share button at the bottom of the screen to share this room on social media or directly with others. If you're inviting others directly that you think may be interested in the conversation, you can narrow the search by using words like sickle cell. We highly encourage everyone to use the share on Clubhouse feature, as it will greatly increase the likelihood that individuals are able to find this room. So that's the little arrows going into each other, and then just the share on Clubhouse, and you can kind of say a little thing about why you're sharing the room. But that will kind of get the room out and encourage people to join. Also, be sure to check out and follow each other in the room. We're inspired, and be sure to follow all our moderators, panelists, and co-hosts here today. For everyone in the audience, we encourage you to raise your digital hands, and we'll do our best to get to everyone's question. For those that don't yet know Consuli, broadly, Consuli is a public benefit company with a mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth about $20K per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive Smart Match individualized offers from us for opportunities including to participate in clinical trials and data trials. There's no cost to join the movement, and you can learn more at consuli.net. It's not there yet, but I'm going to pin a really important research study for sickle cell patients. Consuli is pleased to share that it has teamed up with Sanguine Biosciences and Pfizer to support a really important research study for patients living with sickle cell disease. If you or your loved one has been diagnosed with sickle cell disease and are over 18, and you live in the US, if you qualify, you can help contribute directly to sickle cell disease research from home and be paid up to $1,300 US. It's now my pleasure to turn the floor over to our room moderator, Elizabeth Dreicer, who's a philanthropist, activist, and co-founder and CEO of Consuli. Elizabeth will be introducing our distinguished panelists and guests. Elizabeth, now over to you.
Thanks so much, Spencer, and thanks for making this event possible. Welcome all. We're honored to be able to host and facilitate this room. And as Spencer mentioned, we aim to have this room be very interactive. So the objective here is to engage. So the chat feature, raise your digital hand, we'll welcome folks to the stage. And then just a reminder, I know some of you know this already, but for our new folks, sometimes Clubhouse is a little glitchy. If you get bounced out, just come back in. So that's just another little caveat. I know I was trying to ping people in and the app crashed on me again. So if that happens, just come on back. And then the other thing I wanted to note is that we have created a virtual public whiteboard. Thanks again to Spencer and all. And for those that are contributing, the objective is that this will capture the core nuggets from both this discussion and also other work, and hopefully serve to hold and bridge issues on behalf of the many organizations and many patient advocates that are participating and individuals living with sickle cell disease, both in this discussion and future discussions. So just know that, you know, the core essence of what we're discussing, hopefully we capture the nugget and figure out how to leverage that information into the future. And that's the objective of that virtual public whiteboard. So next up, I'd like to introduce our panelists and guests. And as they join and share a little bit about their background, once I share a little bit about them, would love to have them articulate what they see as the important needs right now in the community, in the sickle cell community at this moment in time. So first up, and actually I'm going to, Lupe, I'll come back to you later when you give us the flash that you're ready to chat. So we'll come back to you. So first up, I'd like to turn it to Ufoma Muwen. Ufoma has lived with sickle cell disease, and now lives sickle cell free after undergoing a bone marrow transplant in 2016. She's currently devoted much of her time outside of academics to pursuing her passion for building community. Ufoma is the founder and CEO of Not Just You, a nonprofit sickle cell support organization that's devoted to creating a support system for individuals and families affected by sickle cell anemia disease. I'm turning the mic to Ufoma for her opening remarks. Ufoma, the mic is yours. This is Elizabeth, and I'm done speaking for now.
Hi everyone. Like she said, my name is Ufoma. You can also call me Foma for short. I'm really grateful to be on this platform once again. I hope you guys can hear me pretty clear. I'm just leaving my house from school.
Yep, you're coming in
But
loud and
yeah,
clear.
amazing. So yeah, thank you so much for having me. And I guess just to jump right into it, in regards to what I think the sickle cell community really needs right now, I would say is resources. And this time I'd say specifically in regards to like accessible resources for not just like sickle cell or like patients, but like Black organizations doing sickle cell research or funding into sickle cell research, just because I know a lot of grassroots organizations, like here in Canada, and I think it works the same in America, they don't have charitable status. And that is the big kicker when it comes to being able to get the funding needed to be able to help families and individuals or conduct really good research. So I think just pumping, especially monetary resources, into the community would be an amazing way to help everyone out.
Thank you so much for that. And we'll come back to that because there are some structures in the United States to sort of fiscally sponsor grassroots organizations that are not, their own charitable organization, but rather they can operate under a umbrella organization. So definitely want to make sure we discuss that at some point, but appreciate you lifting that important issue. Okay, so next up, I'd like to introduce Racquel Ramsumair. Hopefully, I got your last name in the ballpark. Racquel is a mother of two, and one child has sickle cell trait, and the other child has sickle cell disease. After going over a year not knowing that her youngest child had sickle cell, Racquel decided to address the gaps in the Alberta healthcare system. She first joined forces with other organizations in the province and more recently formed the Sickle Cell Advocacy Board of Calgary. The aim of the board is to be a holistic advocate for those living with or caring for individuals with sickle cell disease. I'm turning the mic to Racquel for her opening remarks, including touching on what she perceives as the core needs in the sickle cell community at this moment in history. This is Elizabeth, and I'm done speaking for now.
Hi, everyone. Thank you. Again, my name is Racquel. You were close, Elizabeth. It's Ramsumair.
Thank you.
And I'm the caregiver parent to a child that has sickle cell disease. And I always feel it's important to point out that my other child has the sickle cell trait because, they are the future generations and they can produce others with sickle cell. So um, that's part of what I feel is a core something that's important in the sickle cell community is to address the future. We have children that have the sickle cell trait, and it's really not, doctors don't place an emphasis on that nowadays because you're not affected by it. But really, sickle cell disease is one of the fastest growing diseases out there. And it's because of that lack of education piece. And something else that's very important is for us to network, especially in the city that I am in. We don't know each other, and it's important that we do, and that needs to be addressed. Thank you.
Thank you so much. And hopefully this type of a platform will help more networking and more bridge building. That's certainly the objective. So I really appreciate you lifting that and also, all that you're doing. Um, okay, next up, I'd like to introduce Nalo. Nalo is a is based in the, well, I apologize. Some of this I may mispronounce, so you're just going to have to help me out. Uh, Currently working as a translator and interpreter for French and English. She recently translated a book uh, that's aimed at helping kids suffering from sickle cell disease. The book talks about Dr. McBarnett and her research in finding a suitable treatment. I'll actually, hopefully, Naylo, you can share a little bit more about that. Love to get your opening remarks, including what you perceive as the core needs, and also a little bit more about your book, in the interest that might be something others in this room might be interested in. So, Naylo, the mic is yours.
Thank you, Elizabeth. Hi, everybody. I am actually based in Kinshasa in DRC, Democratic Republic of Congo. I don't know if that's the name you couldn't pronounce. And actually, the book that you are talking about wasn't written by me. I actually just translated it from French into English. And it's actually, I have a friend who is a doctor. She does psychiatric for teenagers and young children. And so I was interested in that in the subject because my mother and my sister, they also have the sickle cell trait. And living in Africa, it is something that people usually only talk about when they are ready to get married, because it's a mandatory like test that you have to do before going to the town hall to get married. And I think for me, basically, what we need from on this side of the world, if I can say it, is more education, because many people, especially in rural area, they still think that sickle cell disease is a curse. So the mental support is needed, especially for the children suffering from it. Also support to the parents, because having a kid that suffers from that is really, really heavy on, I say again, mentally for the parent, financially as well. And sometimes some of the kids are just abandoned. So yeah, education is really important. Thank you.
Thank you. It's great to get a global perspective. And thank you, Nalo. I wasn't sure if Kinshasa was your last name, and I was just, because we didn't have the DRC portion, so that makes more sense now. So thanks for that. And we're glad to have you with us and appreciate your perspective. Okay, next up, Spencer, who's my next introduction?
That'd be Michelle.
Oh, fantastic. Okay, so sorry, Michelle, I'm just sort of, okay, great. I'm going back to you. So Michelle Nelson is an international speaker and the CEO of Next Level Promotion. She's also a sickle cell advocate and co-creator of the Sickle Cell Foundation. Michelle, it's my pleasure to turn the mic over to you for your opening remarks, including what you think are the core needs at this moment in history. This is Elizabeth, and I'm done speaking for now.
Okay, thank you very much. Hello, everyone. And thanks again, Spencer, for the invite. I am definitely a woman that wears many hats, so my bio is pretty extensive. I'm here to support and uplift and pretty much what's needed right now. Let me back up a little. I am a child that has the sickle cell trait. My mom had the sickle cell anemia SS full blown, so lived with the pains, the struggles, and the woes throughout her life up until she passed. And I was there for that. I am originally from Jamaica, and seeing both sides, the US and the island side of how, the funding come about for anyone to get treatment, that's where who the gaps are, and we definitely need to bridge the gaps. We need to find support and be able to implement and the improvements of clinical care, and this needs to be done so that everyone that suffers from sickle cell disease get the improved health that they all deserve. And this is to target both equity of government and even in the private philanthropic scenes as well. So my journey is to get the funding that we need, finding a cure for one. I know that we have the transfusions, the bone marrow transplants, so forth. My partner, who is the original founder of Majority LLC, Miss Brianna Johnson, her son actually has sickle cell anemia, but he had the bone marrow transplant, and surprisingly, he was cured of it. As of his current status, as of right now, it shows that he is clear. So these are the things that we need to be able to share with everyone and get the funding for on a broader scale. And I'm here to assist any way that I can. I do have resources. I have great sponsors and supporters. So I'm just looking to join forces with anyone that would like to collaborate and make this happen for everyone, not only nationally, but internationally as well. And I yield the mic. Thank you so much for having me.
Thank you so much. Appreciate you being with us. Okay, so I think we are due to get a few more people to join, but we'll introduce them as they come on. Is that right, Spencer? I think we've introduced who we have right this moment. And so the next part of our dialogue here is just digging a little deeper, sort of the systemic and also personal needs, and what's next. Just love to have a conversation among the panel. Obviously, we've talked about research needs, cure needs, in some cases, these therapies like bone marrow transplants, and sort of what are the issues that are in the way. In some cases, resources have come up before. And then also the sickle cell and equity connection, which we did touch upon last week. And then just also the personal impact of living with sickle cell, the impact on work, school, life in general, and equity. So, lots of room for input, however you guys want to tee this up. But, those are some of the leftovers from last time. And it'd be great to just get everybody, perspective and dig in a little deeper and see what we can uncover here together. So with that, can I just go around the room and get input? So Nilo, might I pass it to you to see your perspective? Okay, I think you're on mute. It's always required in every meeting. And just a reminder while we are, Nilo, while you're coming off mute, just if anybody in the audience that's living with sickle cell or acquainted with it through family members and or those that feel like they have something to contribute to the conversation, please raise your digital hand and we will definitely engage and endeavor to get everybody on the stage. Nilo, I'm guessing you might be struggling there, so I might go to Ufoma. May I turn it to you? Your thoughts?
Yeah, sure. Just actually I believe it was Nilo and Racquel's kind of points. I think it was Racquel that spoke towards like the future of sickle cell as in the younger generation, and to Nilo's point about in Congo, they actually they require you to do sickle cell trait screening before you get into marriage. I think on a systemic level in all nations, I think that is something that needs to be implemented. Obviously, that wouldn't stop it wouldn't stop a lot of people from having like basically family planning prior to getting married. But I do think that measure, that intervention would actually help decrease the amount of babies being born with sickle cell disease, or just more parents that are more educated before they make that decision. they know how to treat their baby like right off the bat, just because I have so many friends that are in my age. I'm in university, I'm just about to graduate, and I know so many people who just, they don't know what sickle cell is, even though we learn about it every once in a while in biology classes. And like, people don't end up knowing about it till it's too late. And you would think, you know, these are conversations people are having before they're getting into these long commitments of marriage, but that unfortunately isn't the case. And so I think that knowing, like, when I speak to a lot of my friends that are international students and they're coming from Ghana, Nigeria, yeah, places in West Africa, many of them know like that they have sickle cell trait because it's some mandatory screening that they do back there. And then when it's time for marriage, they know that this is something that they have to undergo. Or even within the church, that institution on its own, a lot of churches in West Africa, before they agree to marry a family, they will basically require that you get the test done, and if you don't, you can't get married in that church. And whilst that might seem extreme, I think sometimes when you look at the bigger picture of like a life with sickle cell disease, not everyone is privileged to even have a transplant like myself. So like the treatments, we all know that the treatments aren't as readily available, nor do the treatments that are available work for everybody. So prevention is always better, right? So I think that's like a really big one, is just screening in terms of like in marriage, screening, if that's something that could be implemented in like, you know, regular checkups. Or I know it's not necessarily sexual health, but it is a hereditary disease. So if that's something that like there would be collaborations with sexual health clinics, because we know that that's a sector that actually has a little bit more funding, and it affects a more diverse demographic. Maybe collaboration there would even help for more screening opportunities. So yeah, I kind of rambled on there, but yeah.
Thanks for that perspective. Racquel, can I turn the mic to you?
Yeah, I agree wholeheartedly with FOMA, and I think that it's a very good idea because you're right, that sector has a lot of funding, and they should be discussing genetics, you know, with people in their family planning, but also after the fact. I feel that it's not just going from my own experience. I was always told that I have the sickle cell trait. But what did that mean to me? Like, the doctor will say to you, well, you're, you know, nothing, you won't experience any side effects from having it, so don't worry about it. But really, it is something that you should worry about. I ended up having a child with that sickle cell SS, and that is, you know, a more severe form of the disease. And, you know, maybe I would have done something different. Who knows? And I feel that had I been a little bit more educated about my, you know, what the possibility could be, things might have been different. So I just feel that the education piece after the fact is very important, and it's something that should be discussed on a regular basis, even with your yearly checkup or something, to remind people. I mean, if it was something like ALS that you knew down the road your genetics could affect your child, that child could eventually have ALS, I feel that there would be a different response. And I think sickle cell oftentimes is overlooked.
It's a very interesting perspective, and thank you for sharing that. Yeah, that thought experiment of, you know, what would the communication look like if, you know, this was an ALS-like population and issue. Michelle, I saw you flash your mic, and Lupe, just flash your mic whenever you're ready to join us. We want to definitely get your perspective as well. Michelle, can I turn the mic to you for your thoughts?
Absolutely. I actually shook my mic in agreement, you know, with Racquel. because, of course, I lived through, you know, the whole experience of having, you know, a mother that had the SS full blown, you know, disease, and it was nothing nice. That was, you know, as she stated, that's like the worst of the worst. And it was no easy road. And for me, I absolutely agree with both Filma and Racquel when it comes to education is absolutely necessary. Yes, funding is great. However, we have to educate people because, you know, as they stated, even here in the US, a lot of people do not understand what sickle cell disease is truly. And, you know, it's not only about, oh, what doesn't mean for me having the trait. It's more of, hey, you have to be very careful of who you choose to have children with, because if that person has the trait also, you are, you know, highly going to have a child that has, you know, the sickle cell disease, and even the worst case scenario of the SS. So, you know, for me, it's heart-wrenching because I see over and over. And then for the numbers, you know, 1 in 500 blacks, etc., and I believe, what is it, 1 in 1,000 Hispanics. So, you know, just to have these actual numbers to give out and say, hey, this is something that you guys need to be aware of, because, you know, the communities need to be able to tell their children about, you know, who they're experimenting with and so forth, especially in the day and time that we're living in now, because children are more promiscuous. You know, yes, we were all promiscuous when we were younger, but in this time and age, children are a lot more promiscuous. I see, you know, babes having babies. And if they don't have this information, then we end up in, you know, a worse situation. And then, you know, we see it, oh, you know, the population is increasing, and, you know, we have in the poor neighborhoods and, you know, the underprivileged, underserved neighborhoods, I should say, rather, for lack of better terminology, just, you know, it's just a whole restructure needs to be done from from the bottom up. Implementation of, you know, a better healthcare system, improving everything, improving the benefits that's available. And I could go on and on and on. And, you know, just eliminating the disparities in healthcare quality in its totality. That's what I believe.
Yeah, it's interesting, Michelle. There's been lots of dialogue about that, you know, if one wanted to really address health equity, we would start with sickle cell disease and really supporting both, you know, all the layers of diagnoses, better treatment, more research, proper funding. And if that happened, then the system would get more attuned to just generally improving health equity. Curious your perspective. And then I also just want to acknowledge that we have somebody from the audience that's joining us as well. So we'll get to her as well here shortly. Michelle, did you have anything else you wanted to add? Lupe, anything you wanted to add before I ask? And I apologize if I'm not saying your name correctly, but Sari, you'll have to tell us how to properly say that.
Sorry. Hello, everyone. It's Osase. Yes.
Can you say that one more time?
Osase.
Thank you so much. Osase.
Yeah, so hi everybody. My name is Osase and I have sickle cell disease. I recently had the bone marrow transplant and I'm 6 months post-transplant currently. And I just wanted to say that I agree with Foma, Racquel, and Michelle about the education aspect of things. I think it needs to be infiltrated into school. So I'm also a licensed practical nurse, and I can tell you that they don't teach us about sickle cell disease for more than 5 to 10 minutes, and that's it. It's more of like a scale through, like, okay, do you get it? Okay, good. And it's not even in our exams. And as a nurse, we pay close attention to things that are taught to us multiple times, things that are repeated constantly, that we get tested on, and we see even when we go to clinical, that it sort of like drives that point in that this is an important disease. And based on even people talking about it, if we don't know a lot about it, especially as students, you sort of say, oh, I heard about that through this, or I remember being taught about this because it's been repeated to you more than once. So I think that infiltration into the education system, which again will come from more funding is very key, because we have nurses and we have doctors coming out of school with no idea as to what sickle cell disease is fully, and sort of like downplaying it. And then we have lots of sickle cell patients who are dying because, again, of like miscommunication, or their pain was downplayed. And the more you're in pain, the more your cells sickle, and the more you have a chance of not surviving a pain crisis. So I think if we get to the schools, the nursing schools, the medical schools, that way we're producing doctors and nurses who can become truthful advocates for sickle cell disease. And I feel like that point of education, if you hear a doctor talk about it, or if you go to the hospital and a nurse seems to know more about your disease than you do, it creates a form of hope. And it's like, okay, this disease is not just, it's not silent anymore, it's going somewhere. So I think if we create doctors and nurses who are genuine advocates, that also is a starting point for sickle cell disease.
Very much appreciate you weighing in. Lupe, I see you joined as well, and I'm not sure if I got cut off, but I'd love to turn the mic over to you as well for your opening remarks, your perspective, and also just weighing in on this conversation. The mic's yours.
Thank you. Hey, everybody. Yeah, I just wanted to add on to the aspect of education. For me, like, I'm a nurse as well, so I understand how there's a lack of education in the healthcare field. And then also, I have a bachelor's in health sciences with a preclinical focus, where in our textbook we only had a paragraph of information. And often you see so much information in regards to diseases like cancer in textbooks, but people fail to realize sickle cell is just as important. Luckily, like in my nursing program, the program director allowed me to teach the hematology section, and that made me feel good, because I know that all the nurses in that classroom would be prepared to encounter an individual with sickle cell. Not having that aspect of education on the disease always ends up affecting the patients, and you see it often, especially in the emergency rooms, when doctors ask patients questions like, how long have you had sickle cell, which is unacceptable because it's a hereditary disease. There was a nurse practitioner that I'm really close with who talked to me about a patient she ended up losing because the hospital she went to was not her home base hospital, and they waited hours before they called her hematology team and asked them what they should do. So even beyond the classroom, I think there should be segments of education within hospitals too. When we work in the hospital, we tend to have in-services on different things. I think sickle cell deserves to be its own in-service as well.
Thank you so much for that perspective. And a question broadly and I know the answer may differ depending on part of the world that this is that patients present. The care team for patients that are diagnosed, what's the sort of the specialty oversight? And the reason I'm asking that question is, to what degree are primary care docs really carrying a burden, and to what degree are the hematologists and the hematology team really engaged? Just curious what the intersection is around that specialty primary relationship and how that might differ in overall care quality from the perspective of folks who have seen those different environments. I'm just looking, if you would flash your mic, or maybe I'm curious. Oh, there we go. Racquel, you want to go first?
Sure. So, as a parent, and I live in Canada, in Calgary, Alberta, I find that we kind of have different levels. I'm sure it's very similar in the States. So we have our family doctor who is, a GP, and they don't seem very knowledgeable, and they don't have much to do with anything that's specialized. And then, of course, you have the hematologists who here are really wonderful, and they take the time to understand the condition, and they take the time to know your child, etc. But majority of the time when there's a crisis, you're headed to the ER, who they don't know you. And when you get there, they have several questions. And like Lupe said, many times we get that question, how long have you had sickle cell? As soon as that happens, your heart sinks, because you're like, here we go again. And then they call a hematologist, which some is a person who's on call, and they also don't, sometimes they know you, sometimes they don't. And it's just, you feel like, you know as medical professionals, this is something that all of them should know. It's interrelated as medical professionals. And again, if I hate to sound like a broken record, but so many times I feel like, if this was a different condition, if I came in there and my child had leukemia, I feel like everybody would know. you know it wouldn't be a matter of, I have to call this one to figure this out, I have to, how long has, I just feel like there would be some more background knowledge, and you can really see the gap that this person just doesn't know about this condition. And it's really disheartening when you think that they're all medical professionals, they've all been to medical school, yet every single time I'm starting from scratch.
So appreciate the perspective and the importance of what I also think that you're surfacing that is so often misunderstood is, even with a high quality specialty team, which you're speaking to for your child, in the moment of greatest need and the moment of greatest vulnerability, one is left with the generalists who know nothing or very little. And that is probably the scariest part, right?
Yep.
Yeah.
Yeah, you're supposed to really, trust their knowledge, but when you start talking to them, they don't have the knowledge, and that's a very scary part of it all, because you love your child, you love your family, and if you're the person with the condition, you're even more scared, right? Because you yourself, you don't really know, if this person says to you, okay, I am going to give you 50 milligrams of X drug, do they really know what they're giving me? And do they really know what they're giving my child? And I don't know, as a non-medical person. So it's very, very scary. Like,
Can I chime in?
Yes, please. I was just going to come to you. Thank you. And can you tell me how to pronounce your name?
Well, my name is Esther.
Oh,
So when I hear these stories, it's really heartbreaking, because where I'm at, I have an excellent care team. Like, the moment I get into the ER, because this is how everything is set up where I'm at, it's on record. As soon as I come into the ER, right away, they have to start an IV. They have to start medication. They have to start to try to get the pain under control. And my boyfriend, he was shocked, because he's never met anyone, whether they have cancer or whatever it is, have a care team that I have. And I think it's because of the doctors and hematologists I have, because a lot of them knew my pediatrician when I was in Florida. Yes, you're right. A lot of doctors do not know about this disease. And I was grateful, and I'm grateful, and I'm lucky to have had a primary care physician who knew about this disease. And if I was, let's say if I was in California and I fall ill, I call him. This is where I'm at. Okay, I'm sending a prescription right away. And I think it should be like that for everyone across the board because, one, it will save more lives. Two, I personally think that everyone with this disease, whether they have cancer or whatever it is, any disease, their doctors should create a care plan to make sure that they are okay so that there's no confusion, no one's getting the wrong medication. Because the first time I moved to the state, I had that issue. I had an Asian doctor who never heard of the disease and did not know how to treat the disease and nearly killed me. And since then, I was like, yeah, I have to do a better job on advocating for myself and getting the right team to take care of me because I can't afford for someone to screw up and I lose my life. But that's one that I wanted to say because you as a mother, I honestly think that you should dismantle your team and start from scratch and reach out to people who knows about this disease because it's insane on how, not just blacks, it's people of color, Spanish, people from India. I've seen people across the board with this disease and I'm like, wow. And they go through the same thing. But the crazy thing is once you become an adult, you're treated different. You're treated as a drug addict instead of, okay, you're in pain, I'm going to take care of you. And I've seen that and heard stories from friends. So it really breaks my heart that I'm like one of the few patients with sickle cell who has the best care.
Appreciate you weighing in. And Lupe, I saw you came off of mute. Would you like to join the conversation on this front?
That was actually an accident. I was trying to help Daniel typing and I accidentally clicked it. But I don't want to take away from anybody that does want to add on to this. But I did see somebody ask, what about painkillers? So I wouldn't mind talking about that once we move on.
Absolutely. And I think the floor is yours if you'd like to raise any of the issues. I think we're in open dialogue at this point, just sort of exposition of the issues. And yeah, I do want to just acknowledge, Esther, your point about this difference between child and adult seeking support and the sort of default challenges of, now being in the drug or, sort of painkiller seeking cohort instead of really being recognized. And I can certainly see that. It's a substantial issue. It affects everyone and disproportionately. I think it is, for those that do have substantial pain, this is something that we need to be able to, to do better and to acknowledge this. So Lupe, the mic is yours. I'm going to turn it over to you.
Thank you. So I'm not completely sure what aspect Jake was asking. I know he said, what about painkillers? Sometimes they hoard them and they don't believe the pain levels of people living with sickle cell. Sometimes it does help if, I don't know if everybody knows this, that does have sickle cell or is a caregiver or a relative of someone with sickle cell, but you can get like a treatment plan from your main doctor or hematologist. And this treatment plan can pretty much outline the type of medication regimen that you should be receiving when you're in the ER with a crisis. And I have one myself. And sometimes if you find that you're having a lot of trouble getting the proper treatment in emergency rooms, this is something that you can carry around and provide to providers at emergency rooms that are not, your home base. So for example, if I was having a crisis in a different state and I was having like a hard time with the providers there in regards to what treatment they thought was best, I would, be able to show them my treatment plan that would have the doctor's information that they can call and verify if needed. And that's a way that could help. I know it doesn't always work and it pretty much sucks that a lot of sickle cell patients do get the drug-seeking judgment when they're in hospitals. But there's a plethora of things that you can do to try to get out of that in regards to, reaching out to advocates that are in the hospital or asking for the charge nurse and, reaching out for additional support so you can shift that narrative of not being able to be treated properly like you should be.
Thanks so much, Lupe. I'm curious from others on the panel, Ufoma. Oh, and I see Racquel. Racquel, welcome. Glad to have you. And in fact, maybe I'll just briefly introduce Racquel, just since she's just joined us. So Racquel Logan is a biomedical scientist and doctor with a focus on clinical research. She's currently enrolled at Harvard Medical School with a focus on rare diseases and genetic clinical trials. Racquel, I know there's more to your background, but that's what I have here for the moment. So I'd love to have you weigh in, also share a little bit in your opening remarks about what you see the core needs of the sickle cell community is at this particular time. And then you'll, I'm sure, just catch up in the discussion. So Racquel, the mic is yours.
One second. Hello? Can everyone hear me? I'm
Yes,
sorry.
we can hear you just fine.
Okay, because I'm out in the public, so I'm sorry. I've been very busy today. So I didn't really get everything, but I just wanted to join in. So what was the question? So I can try to briefly answer.
Yeah, sure, Racquel. Just your opening remarks around what you see as the core needs in the sickle cell community at this time. Maybe just start with that.
Well, I think that the core needs should be more marketing, educating people in the communities about it, and educating. I won't say educating physicians because they are familiar with, sickle cell. I'm just not too sure if it's something that is being addressed as much as it should be. It's not being spoken about as much as we may speak about diabetes in the communities. So I think there's just should be more of a pitch of just more discussions on the topic and more programs to educate people overall about the subject.
Thanks so much, Racquel. Appreciate your opening remarks. And Ufoma, can I turn back to you just in some of the recent dialogue that has been exposited, everything from, the some sort of a strategy to retain the information so that as one is moving in the healthcare system from those, specialty care settings to the general care settings to the unfamiliar care setting. Curious what others on the panel are experiencing, that could be helpful to others.
I can't lie. This is actually something that I really do appreciate my team here and just the team here in Edmonton, Alberta, specifically at the University of Alberta Hospital. They are trying really hard to, number one, come up with a smooth transition for sickle cell patients and just other patients within the hematology clinic to move from like the pediatric clinic to the adult clinic, and then also a regime for those who were once in the hematology clinic and now are in the BMT clinic. And then 5 years post-transplant, what happens to you then? Because the reduced intensity bone marrow transplant that myself and Osase also had done as well. That is a little bit of a newer treatment regime, and so there isn't much research. Like last time I was in for a checkup, they actually were like, "Yeah, we're not really sure what to do with you, so we're going to contact other institutions." So that is very telling of like what the scenes are for someone in my case. But they are trying to do lots of research and advocacy on the importance of a smoother transition for many of these patients, because like you can really get lost. Information gets lost. Every institution, every practitioner does things slightly differently. As much as we'd like to think that like medicine is completely standardized, it's really not. And even actually, I think in about 2 weeks, I'll be speaking at a they call them pediatric grand rounds, in which I'll be speaking to a bunch of practitioners, and basically explaining like my story and how moving through the pediatric ward to now the adult units, how it's been kind of difficult because of just even when you have to change institutions. When at first I did my transplant in Calgary, and then I live in Edmonton, so towards the end of my transplant, I had to move back to Edmonton and then switch over to a new hospital. And just the treatment, like there in Calgary, they really did treat me like a little egg. And I thought that, as someone who's going through a bone marrow transplant, that is how I should be treated. And everything should be looked at very carefully. And I remember my mom and I just being so upset when we moved back to Edmonton, and just like we just kind of felt like there was a lack of communication, there was a lack of like care and diligence, and you're trying to say like, hey, like this is not how I was used to doing things for the last however many months or years, for some people. And like, they're supposed to be the experts, so sometimes they can almost want to assert what they believe is correct over what you as the patient living with having the lived experience is trying to say. So like, as I've told some of the practitioners that have asked for my own insight, I think the best way is, number one, like just listening to the patient. Like, I think that is just so underrated in the healthcare community, which is a real shame if you ask me. But just listen to the patient, listen to the patient's caretaker as well. They have a lot, like there are so many details that get completely overlooked that oftentimes the patients and the caretakers try to emphasize so much. And then I think actually just coming up with some sort of intervention, some sort of actual solid plan for transitioning, whether it's developing a system. I know many healthcare industries are finally moving to like online only. So whether it's transferring files or doing, before they make that transition from institution to wards, they go for like a special appointment where all the like important information that a practitioner, if a practitioner or an institution was to take over, they would be up to date enough that they can adequately administer care to the patient. I think that would save so many issues. Like, it's the same reason why nurses, they do their, what is it, like charting or whatever, I can't remember the name, it's escaping my mind, but there are nurses here at the end of shift and the beginning of shift, when you guys all meet to talk, when you give each other briefs on the patient. It's the exact same thing, but just on a, hey, like, I'm one doctor to another or one hospital onto another. And that's what keeps from a lot of mishaps happening within the healthcare system. And I'm sure you as nurses know that if that process isn't done, there are so many things that can go wrong on the unit. So I think the system is already there. It's just implementing it in a new place. So yeah, I kind of rambled on, but I actually have to go now. So thank you guys once again for having me. This was an amazing conversation. I'm going to respond to Jake once more in the comments, and then I will be on my way.
Oh, thanks so much, Ufoma. Really good suggestions. And I think, just some practical things that have emerged in this conversation, recognizing the imperfections of the handoff, which is certainly a universal problem in healthcare, but the suggestions around how care teams can, how the profession can improve in these handoffs, but also how patients can retain their sort of historical records in a way that allows for portability, particularly in those vulnerable settings, that are not part of their general care team. So those feel like very practical, solutions for the moment, or suggestions that, if implemented, would help. In addition to the infamous educational gap challenge that we've talked about. I see that we have Daniel joining us on the stage, and I want to give him an opportunity to weigh in here. Daniel, the mic is yours.
Oh yeah, thank you. I just asked my questions and Tolulope and Foma already gave me a lot of input. I have a stepchild who just got diagnosed with it, with sickle cell disease. So to this point, we live in Germany, like a predominantly white country, so there aren't that many people affected. So you wouldn't know if you wouldn't Google it or haven't watched anything on Dr. House about it, you know. So um, yeah, I just heard that somebody spoke up about having the bone marrow transplant or the stem cell transplant, because the first thing I did, what most parents would do, I went on Google, search for it. I just wanted to ask is if those curative measures like this transplant, isn't this extremely dangerous, or are there methods now that make it less dangerous or risky or whatsoever? Anyway, I'm open to any input on how to deal with that.
I think there's a few people on this panel who have been through it. And then, yeah, if you could flash your mic, whoever would like to speak to that. Yes, please. Osonse? I'm sorry.
It's okay. Osase.
Osase. Thank
Yes,
you.
for sure. Hi Danielle. So for the bone marrow transplant, like any sort of surgical procedure, there are risks to it. However, with the bone marrow transplant right now, the protocol is that it's better off if you have a sibling match. So the donor has to come from within your family member, because there's a higher chance for your body not to reject the donor stem cells. However, the doctors, they're very particular as to who they accept for the transplant, regardless of a match or not, because they make sure that you go through a bunch of workup. So for me, I had to go through a bunch of workup with all my organs, and they had to make sure that my hemoglobin S level, which is your sickled hemoglobin that you want to be at a very, very low percentage, they had to make sure that that number was very, very low before being approved to undergo the transplant. So regardless of the risk, which again, a lot of things have risk, the doctors, if you have a very good team, they do a thorough workup down from, MRI. They want to see your brain. How is your brain working? What do your kidneys look like? They want to get a baseline as to how is your body doing right now before the transplant. And they do not give a go ahead until they know that you are strong enough to handle the transplant. And when you get to that process of now actually undergoing the transplant, it's just like a blood transfusion. Honestly, there's a blood in a bag, stem cells in a bag, and then it's flowing through your veins. And so that's the protocol that I had. And before that, you get injections 5 days before the actual stem cell transplant. But I think that with the team and with the research there is right now, it's not as risky as people might assume. It's not like back in the day where they actually, you go under the knife and they actually uproot the stem cells from your bone marrow. No, everything is done like it's a blood transfusion. And even your donor is going through a machine that mimics that of a dialysis machine. They're taking the blood out and filtering it and putting it back. So it's not as scary as it might seem, because with the research right now, they're very good at making sure that patient is strong enough to undergo the transplant. Sorry, I'm rambling, but I hope that makes sense.
Thank you so much.
No problem.
Thank you so much. Sorry, I got booted out somehow. So apologies for that. I think I heard most of it. Any other perspective on the bone marrow transplant for Daniel from those on the stage or in the audience?
I just wanted to say something.
Please.
So, Daniel, my daughter, we wanted her to get a bone marrow transplant. Obviously, a cure would be wonderful, was a wonderful thought. But I just want to speak up because you should also be prepared for the news that it's not a possibility. And the thing is, I'm sure in Germany, they'll probably have very similar protocols. In Canada, it was basically like, this is how we do it. And so in Canada, in Calgary, you have to, it can only be a sibling, it can only be a parent. And when we were tested, they basically said, you guys are not a match. And I don't know how it is in Germany, if they are willing to go outside of the family group and stuff like that. But, you know, having sickle cell disease, I have had to, educate my daughter that it's it's who she is, and because she has it, it doesn't make her any less of a person. She's gonna live her life and be loved and have good experiences. It's a very scary thing when you hear about it, but there are medications that work wonders. And you know you just have to also be prepared for that outcome, that it may not be a possibility yet.
Thanks so much, Racquel, for weighing in. Any other thoughts for Daniel before we go on to our next topic? Please flash your mic, take yourself off mute. Daniel, do you feel like that was helpful?
Yes, definitely. Thank you so much, guys.
Great. Okay, so I want to open up another discussion topic, which is really around participating in informational research. I'm wondering whether or not any of you are currently in active informational research trials. Just curious, and I'd love to hear from folks. If you go around the room, we'll do that. And if you've ever been asked to participate in informational research, distinct from therapeutic research or any sort of clinical trial per se. But Michelle, can I open it up with you and ask, have you or your family participated in informational research?
Okay, hi. I'm
No
sorry.
worries. Hi.
Unfortunately, hi. No, unfortunately, I did not. Still something that I'm willing to do. My mom, I lost her right before I graduated from high school. So at that time, back in Jamaica, they did not have, or they weren't privy to the information that we have now on, bone marrow and etc. And yeah, if we did, I would definitely have been first in line to help her and, many others. So yeah, unfortunately for me, it's a no, but I'm open to it to help anyone that I can. Absolutely.
Yeah, I was just more curious if you'd ever been asked, and it sounds like no. And this is one of the pieces of research we're even doing, is like, who's even asked to participate in informational research? Racquel, curious, from your perch, I know that you're, sort of in the medical establishment now. What's your take? Have you been asked to participate in any research at all, particularly informational research? We'll come back to you. I'm guessing you're probably still out and about and trying to get the mute button. Racquel, can I ask you that question as well?
Yeah. Yes, I have been part of a few different informational studies pertaining to sickle cell.
Yep. Okay, great. So it sounds like a few, so more than one. So you're in that 1% of people who are asked.
Yeah. I've done one that was kind of examining mental health. So it was one that myself and my daughter participated in, and we participated in another that was exploring, like, racial bias. How do we feel going into emerge? Are we being treated fairly? That kind of thing.
Great. Anybody else on the stage that, or even in the audience, that have participated in research? I'm just curious, in any kind, data, trials, informational research, and any other kind. If you just want to take yourself off mute.
The only one I could think about as of right now is one that was pertaining to hydroxyurea.
Yep.
Sort of like, how often do you take your hydroxyurea? How compliant are you with it? And if you're not compliant, what's the reason for that? And also sort of determining with your compliance, how often do you have hospital visits? That's the only one I could think of right now.
But sounds like that is definitely one. So you're another in the rare minority of people who are actually participating. So that's great. Anybody else from the stage or audience? Lupe, I see you just came off mute.
I've participated in a couple of different ones. The one that I remember the most is my childhood hospital, so Children's Hospital of Oakland, which is now like UCSF Benioff something. They've been following me for majority of my adulthood, I think since like my early 20s, so about 10 years. And every so often they do like a kind of like a follow-up study of like how often I'm having a crisis, and how often I need pain medication, how often I'm hospitalized, and they pretty much just send it to me in a survey format and I send it back.
Got it. So a longitudinal study. Yeah, great. So it sounds like there's quite a bit of interaction certainly for the people on the panel. I'm curious, thinking about your community of fellow sickle cell warriors and families and advocates. What can we talk a little bit about what we think the issues are in terms of participating in both the data trials as well as the participation in research generally? Just kind of want to open it up, safe space to sort of address all the issues. But it certainly feels like despite the great need, it's still challenging for these studies to get enough participation, even when they're just research-based studies. So I'd just love to hear perspectives on why that is and where there are opportunities. So Lupe, I see you came off mute. I'm going to give it to you right back.
Thanks. I think a lot of that could be tied into convenience. Like maybe some people are finding the studies to be too convenient for them. Incentives can also play a role in that. And then I think also you don't really see too many like studies unless, so like for me, I rarely see a study unless like my social worker personally sends it to me. And I know there's a lot out there, so I think advertisement plays a strong role in getting the word out for the masses to see that, okay, there's this study, you can participate in it, because you don't see them often. And especially like there's a lot of sickle cell warriors that are not very vocal or are not really on the scene with other warriors to know what's available to them. So I think having more people spreading the word out, having a stronger like advertising system will go a long way with these.
Thanks so much for that perspective. And Lupe, can I just ask a follow-on question, and then we'll go around the room? Besides the convenience factor and the lifting, the awareness, do you think there are other impediments to participation, particularly in this area? Because this is something that we hear difficult for research to get finished in this area. And so it's just a question of, are there other factors besides convenience and awareness?
I think another factor could simply be like the like being tired. Like a lot of sickle cell warriors that can often be tired with whatever they already have going on in their own lives. So let's say like you have sickle cell and you work full time. That in itself may be a lot for you to the point where you don't want to deal with anything else. And then there also might be some people where they're like, I deal with sickle cell enough. I don't want to deal with it in any other aspect. Those could be factors that, are playing a role in this as well.
I really appreciate you raising those. Racquel, I'm not sure if you found your mute button. Not sure if you're able to join the conversation. I'll give you a 1, 2, 3. Okay, just take yourself off mute and flash us when you're ready. Can I turn it over to our other Esther, I think it is. Do you want to weigh in here? I'm not sure if you have a point of view. Okay, Michelle, can I go to you? Do you have a point of view here?
Sure. I agree with Tolulope, where, some people may just have gotten fed up. And another factor that you have to consider as well is the person or the family that they may have reached out to when the research was initiated. By the time they got around to it, that person unfortunately may not be there. I'm sorry, I got tongue tied, but may unfortunately not be, still alive to even complete this research that they wanted to conduct at the time. So there are different factors that you have to, consider. I know for, my mom, it was just a lot, going back and forth, with the doctors and not having access to certain things, and then the waiting game, and then to, be disappointed again. It's a lot. So I definitely agree with Tolulope on that. They just may have just said, you know what, I'm just over it.
Indeed. Esther, did you come off mute? I wanted to give you a chance.
Yes, I've also noticed that the waiting game is what a lot of people are, I can't find the right word. When I was growing up, they started doing these researches with hydroxyurea. They also have one now. I think an injection you get once a month. And a lot of people don't make it up to then. I lost 2 sisters and a brother to this disease. I have it myself. And my sister died it's about 3 years ago. And because she had a different type of sickle cell. And what I notice now, that Harvard Medical, Tufts Medical, a lot of the big universities here in Massachusetts, because, a lot of them are affiliated with the hospital that I go to. They're doing their best to find a way to help their patients as much as they can. And this is why a lot of my friends that are in Florida, people in California, Canada, they're all over the states, outside of the states. And when I hear their stories, I literally break down and cry, because I'm like, how is it that I'm able to get the care that I need, but no one else does? So, and like Michelle said, it's the waiting game, and a lot of people don't want to deal with that. And they give up, and they lose hope. And it's really hard to just really accept that, especially that I have this illness, and I'm rooting for everyone else with this disease. It's really hard to accept.
I'm so sorry for your loss, and thank you for sharing that. Definitely heartbreaking. I'm going to see if I can say this Osanse. One of these days I might get it in the I know. Sorry about that. I'd love to get your perspective, despite the fact that I don't seem to be able to hear tonality as well as I should over Clubhouse.
No, it's okay. No, I honestly agree with what everyone has said. I know for me, until I turned 20 years old, I did not want to have anything to do with sickle cell disease because all I remember is I go for all this appointments and all you're telling me is I need to add more medications to the list of stuff I'm taking, and nobody seems to be understanding my pain. So for me, it was that repetitive cycle and that waiting game, right? And so I think a lot of it's the mindset of the person you're reaching out to. If they generally don't want anything to do with sickle cell disease, they're not going to care what study you're doing. They're not going to care to even look at that study at all. I know for me growing up, I don't know how old I was, like 16 or 15. I remember this one study had come, I think it was on hydroxyurea too, because my nurse sent a lot of that. But this time it had a compensation. And in my mind, just like a $50 compensation at that age felt like a compensation for the disease I did not choose. It felt good to me that somebody was compensating me for the pain and the stress I have been going through. So that I feel like it will be an incentive to get people to actually follow through with it, especially sickle cell patients some of them cannot keep a job because again we get sick. Like I've gotten fired before because I was out of work for like 3 days or so, and when I came back they were like, that doesn't even make any sense. But I feel like a compensation would be an incentive to get them to do it. But for me, I agree with everything they've said. It's just that waiting game, like where is this research even going to go? I've been suffering from this all my life. What is this simple tick this box and check this box? What's that really going to do for me at this point? So I really think that's part of it, is that you don't know where that research is going, if it's actually going to help you, and you're just exhausted.
It makes so much sense to me, and I appreciate that perspective. Esther, did you want to weigh in with anything else?
No, I completely agree with what she said. Like,
Mm-hmm.
you have a disease that you didn't even choose, and you don't know where the research is going. You don't
Right.
know if it's really, if the statistic is accurate. And it's just, I was talking to my primary care, and what he said to me, he said, my residency here at this hospital ends, but I will follow you through everything because it's illegal. And you being fired because you're sick, honey, I would have filed a lawsuit against the company, because guess what? You did not choose this disease. Like, that's not something. If someone with a different disease can keep their job, why can't you? And that really just like really made my blood pressure go up because that's not cool. That's unacceptable. Yeah, I'm sorry you had to go through that.
Yeah, thank you. Honestly, in my mind at that point is I was just recovering, and so I did not want anything to stress me. And plus, I was trying to take my board exams for nursing as well, so there was like so many added pressure. And I remember calling my mom, and then she just knew what had happened. To me at the time, I'm like, this doesn't make sense because I had originally told you what happened. But at the time, honestly, I didn't have the energy to fight. And I think a lot of people, a lot of sickle cell patients have that. They don't even have the energy to fight for themselves anymore. But yeah, thank you.
But that's what's messed up, because I feel like sickle cell patients are constantly being discriminated against.
Yeah,
Constantly. So why should we just roll over and accept it? It's not okay.
no, I agree.
Yep,
100%.
I concur as well. And it's the lack of terminology again. My mom said it best. She was just tired of being someone's guinea pig and a pincushion.
That was my sister before she died. I'm going to tell this story because what they did to her, the doctors are up here said that is wrong. That was completely illegal, and that was literally unhumane. What the doctors in Florida did to my sister, they forced her in getting a fistula, and her leg, my sister was a petite little thing, and her legs added 200 pounds to her. She couldn't even walk. The fistula was killing her. And they said they experimented on her, and they should not have done that, because you know what? Her life expectancy should have been longer than what it was. My sister should not have suffered her entire life and been bedridden her entire life. So I'm sorry, I'm getting really emotional because what she went through was insane. It literally brought me back to what people were doing in the early 1800s and 1900s to people of color. What they did to her, they made her feel like her choice did not matter.
Yes,
And
yes,
it sucked.
yes. I feel it. I feel you. And I'm an empath, and I'm telling you right now, I believe my mom and your sister experienced some of the same things, and it's barbaric, is the word I was looking for earlier. But it's just crazy, and honestly, the question that you posed, Elizabeth, to sum it all up, part of it is fear. You're not knowing the fear of the unknown. Am I going to wake up, tomorrow? I know that I may not make it based on my disease. However, with them experimenting on me even faster, are they going to cut the little life that I have left here, in half? So it's just crazy, but prayers for you as well.
Esther, thank you for sharing your story, and Michelle, and all of you for sharing your stories. We understand that this is this is real life. It's not just about some conversation that we're having here. The goal of this dialogue is to lift the real issues, lean into the discomfort of the issues, and work towards some pathway forward, recognizing all of the imperfections that are here and present. And one of the challenges, just putting it out there in a very candid way, is that if research can't get done, then we don't get the cures that are ultimately needed. I think one of the gentlemen on the session last week said, this disease has been known for what, I think it was 400 years. I haven't done the Google search to discern whether or not what the exact date of awareness was, but perhaps Spencer has done that. And so this is not new. And that was a big theme from last time, is like, why is it still not resolved? And one thing that we're learning is that research is halted because there aren't enough participants, and therefore we're not making the progress that needs to be made, even when there is focus on trying to get awareness. So this is why we're really leaning into this, and ultimately, how do we make this matter, right? I think that's what everybody's speaking to is people are tired. It hasn't been resolved in all this time, and there have been really unacceptable ways of being treated. So how do we find a pathway to hope? And so what I'd like to do, as best as possible, is just go around the room, just sort of parting thoughts, and then we will close out our second edition. And if I can, Lupe, can I? I don't want to mask over the discomfort of what we've just discussed. So, whatever is authentically true as you're leaving, if it's frustrated, if it's, hey, at least we're having this conversation and it's imperfect, but it's better than not having it. Whatever's on your heart, I'd love to hear from you, and I'm sure this will be beneficial to all. So, Lupe, can I turn it to you for your closing remarks?
Yes, because I actually do have to hop off now. But I'm so glad I was able to join you guys today, and I truly appreciate you guys for hosting this space again and inviting me to speak again. I think this doesn't what is the word I'm trying to say? Like this goes a long way. Like what you guys are doing goes a long way. So I really appreciate that.
Thank you for being with us. Racquel, are you able to come off mute with some closing thoughts? I think Racquel might be transiting, so we're not getting her. Oh, there's two Racquels. I'm sorry, Racquel. Um, the Racquel with the party hat. That's going to be my distinguisher.
Yeah,
There you
that's
go.
me. In parting, I would first like to say my condolences to Esther. And, these conversations and our grassroots organizations all over the world, we just have to keep at it. We cannot give up because not everybody is going to go for the cure. There's always going to be people living with sickle cell disease. And it's just, like I said, we just have to keep at it and, work hard, love one another, and, don't give up.
Thank you. Michelle, your closing thoughts?
Just want to say thank you again, Spencer and Elizabeth, for having me. And I appreciate everyone that shared their stories and their thoughts on the matter. And in closing, just, continue to do what we all are doing, advocating for, the cure and, supporting, sickle cell warriors. And pretty much just, making sure that whatever we do, we back the development and being able to disseminate, promising approaches on how we can reduce these disparities and just move on from there.
Thank you so much. Asase?
You got it.
Yay! It only took me like 5 times. Thank you.
And that's usually how it goes, so it's okay. Um, I just want to say that I love the fact that this is a conversation that we're having, because I think the key thing to like solution is knowing that there's a problem, and this conversation is bringing up the problems and like the disparities and the gaps that are in the sickle cell community. And I just want to say, like, the more conversations we're having, the more people feel okay to be vocal, because I know lots of sickle cell patients are still in hiding as to, oh, should I share my experience or should I not share my experience. But I always think about the next generation to come, like Danielle saying that, um his family member who's 12 years old just got diagnosed with sickle cell disease. And I'm very certain that when she goes online, she sees conversation like this, she sees other people sharing their story, and she finds a source of hope because people feel comfortable sharing their story. So I love conversations like this. It always gives hope to everybody else who are still in hiding, or people who are started their advocacy, or people who've been advocating for a long time. So thank you so much, Spencer. Thank you, Elizabeth. Thank you, everybody, for sharing your story and trusting us with your story. So yeah.
Thank you so much. And Esther, I want to give you the last word and then I'll turn it to Spencer.
Well, I want to say, live in love, light. I want to send positive energies because this is a great room. Although I came in really late, I've learned a lot. I have another sickle cell meeting, a support group. We do it every other Saturday. And I shared this room with them because the information that was needed to hear for them to understand, okay, it's not just us trying to give a good fight. It's not us just trying to find a solution. There are other people out there doing their best to figure it out. And because I feel like we're all in it together. Every sickle cell patient, we're all in it together. I mean, if we don't have each other, who else do we have? Because we don't even know who we can really trust when it comes to our disease. Because what I've learned over the years, doctors just want to get paid, drugging you up and introducing you to new things, to new studies. And in your mind, you're thinking, is it really a good thing for me? But thank you for this room. I've learned a lot, and I will definitely talk to my fellow friends, my sickle cell friends. We have such a brotherhood and sisterhood. Most of the we all grew up together, so I'll let them know about this room and what we talked about in this room. And thank you again. I really do appreciate
Esther, we're glad to have you, and you're welcome to come back at any point and have others join. With that, I just want to, extend a deep thanks to all. I also want to thank Spencer again for making this happen. He's really the magic behind all of this. And Spencer, I'm turning the mic back to you for your closing remarks.
Hi, everyone. I just want to, commend the bravery and strength it takes to come and share your story and share your experience and be vulnerable in this room. Esther, Osase, and Michelle, thank you for really bringing light to some of the important experience that a lot of people are facing in this community. In closing, as we wrap, I just want to make a few announcements. We host this room every week, so be sure to come by next Thursday. And if you know someone that might want to speak or might want to be a panelist or know of a community that should be engaging in this conversation, feel free to reach out to me. My information's in my bio. Be sure to follow everyone here so that we can really see when conversations like this are happening and kind of grow this community together. As a reminder, pinned to the top is a really important research study for sickle cell patients. We've teamed up with Sanguine Biosciences and Pfizer to support an important research study for patients living with sickle cell disease. So if you or someone you know has been diagnosed with sickle cell, you're over 18 and you live in the US, you can contribute to this important research and be compensated up to $1,300 for your time, and hopefully to extend research in the hopes of finding a cure. So once again, from the deepest of my heart, thanks to everyone for coming by and sharing this experience. I'm gonna leave the room open, play a little bit of music, so that people can peruse around other people's bios. And until then, see you at the next room next Thursday.